Hello, and welcome to the Health is the Key podcast, where we explore the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. Today, we're talking about something we all crave but can't seem to get enough of: sleep. The American Academy of Sleep Medicine and the Sleep Research Society recommend that adults ages 18 to 60 sleep at least 7 hours a night. But a recent Gallup survey found that more than half of adults in the United States said they're not getting those 7 hours. Babies do it, cats do it, a lot of it. How hard can this be? On the phone with us to explain the mysteries behind sleep and the secret to getting restful sleep is Dr. Harly Greenberg, Chief of the Division of Pulmonary, Critical Care, and Sleep Medicine, calling in from the Department of Medicine at North Shore University Hospital and Long Island Jewish Medical Center. Welcome to Health is the Key, Dr. Greenberg.
Thank you. Happy to provide some insight on this important topic.
Thank you. I mentioned the mysteries of sleep because many scientists say we don't know exactly why we sleep. So why the recommendation of at least 7 hours? What exactly does sleep do for your body?
So this has been a topic for sleep scientists for decades, and there's been many, many years of research on why we sleep and the importance of sleep. But to put it simply, sleep is done by the brain, for the brain. It improves neural recovery from all of the functions we do during the day. It consolidates memory. It improves our ability to learn new things during the day. And as well, it leads to improved functions in many aspects of our health. So when people are sleep deprived, they typically report difficulties thinking, making decisions the next day. They may have difficulty with their ability to remember things. And then there are a myriad of health problems that come from insufficient sleep.
So physical as well as mental.
Physical as well as mental.
Wow.
So we know that people who are deprived of sleep may have increases in their blood pressure, may have metabolic problems such as higher blood sugar levels. They may have increased risk of cardiovascular disease. So sleep is important not only for the brain function, but also for the body, cardiovascular function, and metabolic function. We speak about sleep needs, and you had mentioned the American Academy of Sleep Medicine, National Sleep Foundation, all recommend 7 to 8 hours. But it's important to recognize that sleep needs varies across the population. The mean is 7 to 8 hours, but there are some people who need more to feel refreshed, and some people can get by on a little bit less. So these are general recommendations.
It's not across the board. And do teenagers sleep more or require more sleep than adults?
Absolutely. Sleep needs increase as you get into the younger age groups. So, for example, an infant may sleep 16 to 19 hours a day, a toddler 11 to 14 hours, but a teenager typically needs 8 to 10 hours of sleep. So there is a decrease in sleep needs as we get a little bit older into adulthood. But a common misconception is that geriatric age patients need less sleep, and that's just not true. They need the same amount of sleep as adult age individuals, but it just may be spread out a little bit more across the 24-hour period.
And we want to talk about the quality of sleep. What is considered good sleep?
So there are various definitions, but good sleep for most people is really that you sleep the number of hours you need to feel refreshed, and whether that's 7 to 8 hours or maybe 8 to 9 hours, and you wake up feeling refreshed. You don't have any unintentional sleep episodes occurring during the day. You may have a little bit of dip in alertness in the mid-afternoon. That's normal, but otherwise you're refreshed and functioning to optimal level. Sleep difficulties come from difficulty falling asleep or difficulty initiating sleep and difficulty staying asleep. It's normal to have awakenings roughly every 90 minutes across the night. That's our normal cycling of the stages of sleep, but it's also normal to fall right back asleep after those awakenings. But when you wake up in the middle of the night and can't fall back asleep, that's a sleep maintenance problem. And people who sleep 7 to 8 hours and still feel tired and unrefreshed, they may fall asleep during periods of inactivity. That represents inadequate sleep and may indicate a sleep disorder.
Huh. And what are some things that, first I want to ask, the every 90-minute awakenings, are you aware of those, or do you just go back to sleep?
Mostly not. So sleep will cycle through non-rapid eye movement sleep and rapid eye movement sleep, or REM sleep. Many people have heard about. That's where most but not all dreaming occurs. And these cycles of non-rapid eye movement sleep to rapid eye movement sleep are about 90 minutes in duration, and there's a brief awakening after each of these cycles. We're typically unaware of these awakenings. We fall right back asleep after them. But in some people, they have difficulty returning to sleep after middle of the night awakening.
And what are some of the things that cause poor sleep, that contribute to?
So the most common thing that causes poor sleep is acute or chronic insomnia. And so when we go through life, there are obviously many stressful events that occur, and those stressful events can raise our level of alertness. We may be anxious about something that just happened. It may lead to rumination about this issue, and that can lead to both difficulty falling asleep and difficulty staying asleep. Typical insomnia after a stressful life event. But when difficulty falling asleep or staying asleep persists for more than several weeks, we call that chronic insomnia, and that is a persistent problem that can lead to poor sleep, and it's probably the most common cause of difficulty sleeping.
And many of our members, the healthcare workers, are shift workers, which is especially hard to get into a natural rhythm. What can they do to improve their sleep?
So night shift work or rotating shift work is really hard on the body. People who have night shift work really have to make it a top priority to protect their sleep. So when you work at night, you're trying to stay awake when your body's clock is telling you to sleep. And any night shift worker knows that might be a struggle, particularly in the early morning hours. But it is very important when you get home from a night at work that you have a protected sleep period so that family members are not disturbing you, that you have a quiet place, your phone is off, so that when you get home from work in the morning, you can dedicate at least 4 to 6 hours to sleep in the morning hours. The other thing that many night shift workers do is they may have 4 to 5 hours of sleep when they get home from work in the morning, and then they may have a 1 to 2 hour nap before they go to work for the next night shift, kind of a bimodal sleep period, and that often gets them a total of 6 hours of sleep during the day before their night shift. It's really hard to do because family demands, noise, other interruptions during the day are constantly disturbing a night shift worker's sleep. But it is crucial that they get at least 6 hours of sleep during the day in order to function optimally during the next night, and also to really prevent the effects of chronic sleep deprivation from affecting their health.
And some of the solutions that we hear about for poor sleep, like, if you wake up in the middle of the night, get out of bed. That just seems counterintuitive. So what are some real life solutions that are doable?
Right. So when people have chronic insomnia, meaning their insomnia lasts for more than several weeks after an acute stressful life event, that life event may have been resolved, but the insomnia lives on. And it lives on mostly because of poor sleep-related behaviors. So it's very important to have, if you're not on a rotating shift, to anchor your sleep with the same wake-up time each morning. So whether that's 6 a.m. or 7 a.m. or 8 a.m., it should be set as an anchoring time to wake up at the same time each morning. And you should try to go to bed at the same time each night. But what we've learned, if you have problems with insomnia and you're lying in bed awake for prolonged periods, you begin to get very frustrated about the fact that you can't sleep, and you develop a subconscious association of your bed and bedroom environment with a state of frustration and increased alertness when sleep is desired. So the recommendation that everyone has heard is that if you are unable to sleep for more than about 20 to 30 minutes, to leave the bed and bedroom, to break that association of the bed and bedroom with a frustrating place where you can't sleep. Do something relaxing in another part of your house, and when you feel sleepy, go back to bed. It's called stimulus control. It's a basic premise of behavioral therapy. You eliminate the alerting environment, the frustrating environment, eliminate those ties in your mind between your bed and bedroom as a place where you can't sleep, and eventually your sleep will be improved. So that's one of the key points. But a lot of people with insomnia and difficulty sleeping report a very variable wake-up time and a very variable to-bed time. And that is really counterproductive. We have to align our sleep with our body's 24-hour clock or circadian rhythm, which optimizes the time for sleep, and having a anchoring wake-up time in the morning and getting outdoor light exposure in the morning after you wake up helps to lock in that circadian rhythm and your sleep time to the desired time of sleep during the night.
So keeping to a schedule, eliminating stimulus, those are doable.
Right, exactly. Eliminating the behavioral stimulus of lying in bed, ruminating about why you can't sleep.
Why can't I get to sleep?
Staying awake in bed, all night, struggling to fall asleep, just reinforces the fact that you can't sleep in your bed and bedroom environment. So it doesn't help to lie in bed awake to, quote, rest, unquote. Get out of bed, do something relaxing, and when you feel sleepy, get back to bed.
What about, there are so many solutions out there, expensive pillows and mattresses. Are these necessary, or is it just more natural to adjust your lifestyle and keep to a schedule? You feel like, I need this pillow to make me sleep.
So adjusting your lifestyle, your schedule, not bringing worries and concerns to the bed and bedroom, not bringing your computer to the bedroom. These are all the prime things. But having a bedroom environment that's quiet, cooler rather than warmer, and comfortable is important. So you need to have a mattress and pillow that's comfortable for you, but there's no one specific device or pillow or mattress that's going to be a solution for everybody. Just make sure it's a comfortable scenario.
That's good to hear, and save our members some money as well.
Exactly.
Can we talk naps, pro or con?
So naps are certainly useful. They can supplement sleep in a person who's getting insufficient sleep at night. So, for example, if you are limited in your ability to get 7 to 8 hours of sleep at night, whether because you have to report to work really early and you just can't fall asleep early enough to get 7 to 8 hours. For example, if you have to wake up at 4 a.m. to get to an early shift, and you would have to be asleep by 9 p.m. to be able to get 7 hours, and you're just not able to fall asleep that early. That's understandable because our body's circadian rhythm or circadian clock has a really built-in bedtime and awakening time for most of us. So if you can't get your 7 to 8 hours at night, supplementing with a nap after your shift to try to get you up to that at least 7 hours of sleep time could be useful. The best times for napping are in the mid to late afternoon hours, but you should limit your naps to no more than 30 to 45 minutes, because if you sleep longer than that, one, you'll get into the deeper stages of sleep and you may find it difficult to wake up and function afterwards. And two, it will disturb your next night's sleep. So set an alarm if you need to nap. Give it 30 to 45 minutes, but avoid those 2-hour naps at the end of your shift in the afternoon.
So naps within moderation are okay.
Within moderation are absolutely okay and can really supplement your sleep bank, so to speak.
The thing that's so promising about the solutions that you've outlined for lifestyle change is that anybody can do it. That you don't need a drug or any other kind of intervention. But at what point does it become a problem when you should seek professional help?
So if you have chronic insomnia, meaning difficulty falling asleep or staying asleep, and that is resulting in daytime problems. In other words, you're not functioning properly. You're unable to stay awake and alert during the day. It's causing fatigue. Then you do need to seek some help with this. And you can certainly start with your primary physician. But if insomnia is occurring 3 or more nights a week, lasting more than 3 months, and there's no other explanation for it, seeing your primary physician or seeing a sleep medicine specialist can help. And there are certainly medications to help you sleep, but our primary goal is to optimize sleep-related behaviors, and we can do that using what's called cognitive behavioral therapy for insomnia, teaching relaxation techniques, teaching better sleep-related behaviors, and really optimizing how you think about sleep. And that can be a really successful means to treat insomnia problems when you really don't necessarily need to take medication.
That sounds really helpful because it puts the power back in your hands. And, full disclosure, I am not a good sleeper. So to offer me a little more hope is if you are a chronic poor sleeper, can you change? Can you teach an old dog new tricks?
Well, you certainly can, but in addition to just chronic insomnia, you need to make sure that there's not an underlying sleep disorder. And what is so prevalent in our population is obstructive sleep apnea, heavy snoring, and obstruction to breathing at night. It goes hand in hand with the increase in obesity that we see in our population, but it can also occur in individuals who are not overweight. So in addition to the insomnia recommendation, if heavy snoring or someone witnesses that you're gasping for air or stopping breathing at night, that could result in disrupted sleep. It can have serious cardiovascular and other health effects. And if that's present, you should really seek treatment with your healthcare provider. There are other conditions that can disrupt sleep as well, conditions that cause discomfort, particularly discomfort in the legs or lower extremities when you're trying to sleep, something called restless leg syndrome. That's quite prevalent, where individuals experience an irresistible urge to move their legs and uncomfortable sensations in their legs prior to bedtime and when they're sitting still. It can be a contributing cause to chronic insomnia. If these symptoms are present, definitely seek the advice of your healthcare provider.
Okay.
But beyond that, we need to improve sleep-related behaviors and our lifestyle. Another key point is people don't realize how long the effects of caffeine can last. So if you're drinking coffee to stay awake during the day, coffee pot at work, it's important to note that the effects of caffeine can last from 5 to 10 hours after your last cup, and it can be a contributing factor to insomnia. And there's caffeine not only in coffees and teas, but also in other foods like chocolates. And if you're having trouble with sleep, make that last caffeinated beverage in the early afternoon, not at the end of the day.
Right. And that goes for sodas as well, and
Yes,
alcohol.
caffeinated coffee, sodas, and alcohol should never be used to help with insomnia. Alcohol can be very counterproductive. While you can fall asleep more quickly with it, it typically leads to multiple awakenings for the rest of the night, can worsen snoring and sleep apnea, and can have long-term adverse health effects. So never turn to alcohol to help sleep.
And that's such a common thing. Oh, let's just have a nightcap.
Yeah, exactly. Every once in a while, it's certainly fine. I'm not telling people not to indulge every once in a while, but it is not a treatment for chronic insomnia.
All right. Well, you've given us a lot of great advice. Can you give us one takeaway for our members to improve their sleep, whether they're a good sleeper already and want to get better, or they're having difficulties? What's the one thing that you would leave them with?
Our society has reduced the importance of sleep. People are active so much longer during the day with our electronic devices. So the total sleep time that we get as a society has declined drastically over the last century. And insufficient sleep can contribute to obesity. It can contribute to high blood pressure, cardiovascular disease, as well as difficulty with thinking and memory. So it's important to protect your sleep. And that's important whether you are a rotating shift worker, a night shift worker, or you work a usual 9 to 5 shift. Protect your sleep. That is the message. Don't cut back on your sleep, because insufficient sleep and sleep deprivation builds up over time, and people who are sleep deprived, not getting sufficient sleep, are often unaware of how significantly it's affecting your daytime function. So my message is protect your sleep. Don't teach your body of the sleep it needs to function optimally.
That's great. I think that's a great takeaway and something our members will really take to heart. Thank you so much again for your time, Dr. Greenberg. We really appreciate it.
Thank you very much for the opportunity to speak to the members.
If you need help winding down at night, tune in later this month to our August keynote for a soothing sleep meditation led by the Benefit Fund's own Lupe Flores. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.